Good morning, everyone. Today we continue with the second part of Chapter 14, Assessment of Sensory Perception and Social Participation Capacity, Part 2. I am your presenter, Tan Yukin. This chapter focuses on evaluating two key abilities in older adults' capacity to use transportation for outdoor activities and social interaction capacity. These competencies serve as crucial indicators for assessing independent living ability and social adaptation in older adults, directly impacting their social participation and quality of life. They represent essential components in comprehensive geriatric assessment. Let us begin today's study. The chapter content is divided into two main sections. Section 1. Assessment of ability to travel by means of transportation. Section 2. Social interaction capacity assessment. These two components collectively form the core assessment framework for evaluating social participation capacity in older adults. We will now examine each section systematically. We begin with the assessment of ability to travel by means of transportation, which holds significant importance for older adults to maintain independent living and social connections. Let us examine the specific definition and components of this assessment. The types of transportation used in the assessment of ability to travel mainly refer to bicycles, tricycles, private cars, buses, subways, taxis, etc. The assessment of an individual's ability to use transportation includes evaluating whether they can cycle or take public transportation, including taxis, independently, and whether they require assistance or accompaniment when using public transportation. The assessment of an individual's ability to use transportation typically employs an interview method. Next is the crucial aspect of assessment scoring criteria. Typically, this type of assessment establishes several levels. For example, 0 points may indicate complete dependence on others unable to use any transportation independently. 1 to 3 points may represent requiring partial assistance or being limited to using only a few types of transportation. 4 points indicates the ability to completely independently use required transportation for travel. In practical assessment, precise scoring requires reference to a detailed behavioral description checklist. 2 essential points require particular attention during this evaluation. 1. The distance traveled by bicycle or public transportation and the duration of travel are not within the scope of the assessment of the ability to travel by means of transportation. 2. If the person being assessed only moves within a walking distance and has not used transportation to go out, the assessor may conduct a comprehensive assessment based on the inquiry of the person being assessed and the caregiver combined with the performance of the other abilities of the person being assessed. The first part of our content concludes here. Now we proceed to the second component of today's session, social interaction capacity assessment. Social interaction capacity represents a crucial ability for maintaining psychological well-being and social functioning. Social interaction capacity refers to an individual's ability to communicate and interact with others. The assessment of social interaction capacity includes evaluating whether the individual can adapt to society, proactively approach others, and interact with them. Social interaction capacity assessment generally uses an interview method. The table shows the scoring criteria for social interaction capacity. The scoring for social interaction capacity is typically graded based on the initiative, frequency, depth, and appropriateness of interactions. For example, score 0 may manifest as social withdrawal with near total refusal of social engagement. Intermediate scores may indicate passive responsiveness with minimal initiation or difficulties in interaction methods. The maximum score reflects the ability to engage proactively and appropriately in social interactions. In practice, factors such as cultural background and personal experiences must also be considered as they may influence social capacity. Evaluations should be conducted with reference to specific scoring guidelines. The evaluation of social interaction capacity involves greater complexity and subjectivity, necessitating emphasis on 4 key points. 1. Before the assessment, the assessor should understand the personality, preferences, and living habits of the assessee. If the assessee is unwilling or not good at interacting with others, the assessor should conduct a comprehensive assessment based on the actual situation. 2. If the subject of the assessment has depressive symptoms, the assessor should conduct a comprehensive assessment based on the assessment results of the subject's mental state. 3. Throughout the assessment of the elderly's abilities, assessors can carefully observe the assessment subject's performance in social interactions. 4. The assessor should inquire in detail about the assessee's performance in social interaction within the past week from the caregiver. If there is a discrepancy between that performance and the assessee's performance on the day of the assessment, the performance that occurred more frequently should be used to judge the assessee's social interaction ability. Now let us examine an overview question. Mr. Zhang, 70 years old, a retired teacher, suffers from mild cataracts. He lives alone as his children work in other cities. For the past month, due to declining vision, he has stopped cycling, but he can still independently take the bus to the community senior activity center. He is rather introverted and not good at initiating social interactions. Based on the assessment criteria for the ability to use transportation, what level should Mr. Zhang's current situation be rated as? Please explain the specific assessment criteria. Today, we have studied the assessment methods for ability to travel by means of transportation and social interaction capacity. We hope everyone can master these key assessment points and apply them flexibly in practical work. Remember that each assessed individual is a unique person requiring our attentive understanding and evaluation. Keep in mind that assessments should not only be accurate but also demonstrate humanistic care for older adults. The ultimate purpose is to help older adults better maintain social participation and improve their quality of life.